pounds. Jane lost 13 stone, but she's now left with this.
Well, it's my stomach, because it swings to and fro, and if I walk too fast, the ground comes up and hits me.
And this will never get better by itself. This has got to go.
Alan White is a former soldier and athlete who at 28 stone is virtually confined to a wheelchair.
I feel the need to be eating something. I feel the need to be full all the time. If there was a magic pill somewhere that made you feel full up all the time, then I wouldn't be eating what I eat nowadays.
Expect graphic scenes of gastric bypass surgery on Fat Doctor. Britain is now the fattest nation in Europe. Almost a third of Britain's adults are dangerously overweight, and the figures continue to soar. Hospital admissions for weight-related problems have rocketed by 50% in the past 2 years, and obesity now claims the lives of over 1,000 people a week. But for many, however hard they try, they simply can't get rid of the fat.
I find that I am definitely addicted to food, that I feel like it's controlling me. I'm scared that if I don't do anything about it, that it's going to beat me. It's going to be too late, and I want to get back out there for my children.
It's like this little monster on your shoulder that says, go on, eat something else, eat it. And it is like an addiction, you get to food. If we're happy, we'll all eat. If we're miserable, we'll all eat. And most people's opinion is, you're fat, stop eating. But it's not that easy.
I'm just addicted to the wrong things and the wrong quantities, I think. I don't know how many calories I put away a day, but I'm sure it's not right. I'm really desperate to get this weight off because my life at the moment is 0.
In desperation, many of Britain's biggest are turning to this man. Bariatric surgeon Shaw Summers helps the morbidly obese lose weight by reducing their stomachs to the size of an egg.
That's it, and that's what I call my staple diet. Until someone comes up with a magic injection or a tablet that can deal with obesity for the long run and can work long term, I'm afraid surgery is the only thing that really does the job.
It's a last resort for the patients he sees. Many have struggled with their weight since childhood and have spent their lives fighting the flab.
The question whether genetics or environment are the principal causes of obesity is a really difficult one to answer, and I think in reality both play a role. There are some people who come from a genetic line, a family that are big, and they will be destined to be big. But there are others who come from relatively thin families whose environment, habits, psychological makeup lead them to overeat or to eat inappropriately, and they become big. So I think the interplay between those is the defining cause of obesity.
The results of this extreme weight loss surgery are often staggering. Here are some of Shaw's former patients at their annual reunion.
At my heaviest, I was 38 stone. I'm 24 now, so another 6 stone and I'll be back playing rugby. Best thing I could have done, you know? And it beats the alternative, doesn't it? Which is 6 foot under, so, yeah.
In 2.5 years, I've gone from 35 stone to 20 stone. Just not having to worry about sitting down, will that chair hold me? Can I get my hips in? I just feel so much more healthier, happier, and it's just brilliant.
This is when I was just under 32 stone 2.5 years ago, and I've now lost 14 stone. I was asked once, would I have it done if, you know, knowing what I know now, would I have it done? And I'd say, show me the operating table.
It's stories like these that give hope to people like Alan White, whose lives are being ruined by obesity.
If I look at myself in the mirror, I know that everything that's wrong with me is because of my weight. I'd like to be nice and thin. I'd like to be nice and active again. I like to feel good all the time. Unfortunately, being this weight, you just don't feel good all the time.
So that's your...
Jane Floyd is near the end of her weight loss journey and ready to enjoy life again with her twin, Sally. But will a new operation work?
We can get back to old selves and do things now. Do things that we used to do when we were younger. Mischief. No.
Jane Floyd weighed 35 stone when Shaw Summers gave her weight loss surgery 7 months ago.
Nice to see you again.
Today, she's returned to see him to discuss the next stage of her journey.
How are you, Sally?
With Jane is her twin sister Sally. She had weight loss surgery 3 years ago. Jane's problem is a common one. Losing 15 stone has left her with an outsized problem.
Can I just ask you just to lift your skirt up as you are? So that's your apron.
That would be ridiculous.
It's gone to one side. Well, should it be up the middle?
Yeah.
All right, well, whilst I've got a full view of it, what you can see is it's all swollen and what we call edematous. This is fluid because it's hanging down so much.
Yeah.
The fluid is actually collecting in the bottom, and this will never get better by itself.
Okay.
It has to be cut away. And as you can see, it's resting on your knees and causing you... Does it get sore inside
it gets
at all?
sore here and it gets sore down there too.
Yeah.
Yeah.
But this has got to go.
Yeah. That's sort of,
I think you're probably going to lose 2 or 3 stone with this off, so you'll be even lighter.
yeah.
Now, your tummy button is also right down here,
Yeah.
way past your knees.
Yeah.
Is that special to you, or would you be happy without a tummy button?
Okay.
It's not something you're particularly fond of.
No.
Because in order to fix all of this, there is a chance I might not be able to save your tummy button. If I can, I will, but you're not bothered about it. Okay.
It's gone, it's gone.
Can I ask you to stand up so that we can have a little look at this with you standing? Right. So there's my scar that I did the operation. Here's your original gallbladder surgery, which should have been up there.
Yeah.
It's now down here.
Yeah.
And here's the hernia through your gallbladder operation.
Yeah.
Now that you've lost the weight,
Yeah.
you can see that the tummy's gone south, but it's left the hernia behind.
Yeah.
But if I can remove all of this
Yeah.
right the way through to there, I can then fix that, get rid of this and get you more mobile.
Oh, yeah, yeah.
Happy for me to get on and do that?
Yeah.
Okay.
Sally too has excess skin. Since her operation, she's lost 16 stone and hopes one day to have plastic surgery to remove all this.
That's right. Your normal arm should be to there, but unfortunately, because you've lost weight, it's almost deflated, and this is just like a...
Yeah.
it's what they call a...
Yeah, I keep burning myself
bingo
with this one.
wing.
Yeah. Yeah, it's a bingo flaps. Yeah.
We could probably take up all the spare bits and make someone else out of it, couldn't we? Right, I'll see you shortly, I hope. Okay, nice to see you both.
Over the years, fighting obesity is a battle that Jane and Sally have fought together.
Yeah, we put on weight together. You lost it, then I lost it. You put it on, I put it back on, then you lost it, and it was just like yo-yo between both. Both struggled together. Yeah.
Now they can hardly believe the benefits weight loss has brought them.
It's amazing, though, really. I never even thought I'd get to this day. I thought I'd be big for the rest of my life.
Yeah, so did I.
Yeah, thought we'd just plod along together, being plod along and big. But we can get back to old selves and do things now.
Do things that we used to do when we were younger. Mischief.
Clearly, both the genetics and their environment conspired against them, and they put on a lot of weight. And now, having both had successful bariatric surgery, they're on their journey towards having a more normal, more acceptable body.
That genetic predisposition to obesity was evident from a very early age, as their mother, Mary, will testify.
They were quite big when they were born, and then when they were teenagers they would have lots of different sweets and that, because they do jobs around the house, so that they'd get money for it, and then of course then they would go down the sweet shop and that was it, and fizzy drinks and wasn't it.
For Jane, it wasn't easy being an overweight teenager.
Yeah, I was really bullied. There was one certain girl that used to, pick on me quite a bit and call me names and so, and I didn't like it, but we tried to avoid her, but I just went downhill from, every time someone called me, I just wanted to eat. I had to shut myself away and eat, to make myself feel better, but no, it didn't work.
The diets that Jane and Sally tried just never seemed to work. The weight always went back on. Then when Jane lost her husband, Leslie, 4 years ago, her eating went out of control.
Close myself away and do nothing, because I just didn't know what to do. And this is when I got bigger and bigger.
As Jane's weight soared to 35 stone, her eldest daughter Catherine took on the job of looking after her mother.
I've been caring for my mum since I was 15. Cleaning the house, cooking all the meals for her, going shopping every week. She wouldn't get dressed in the morning. She was in her nightie all day, unable to wash herself, so she wouldn't wash for a couple of days. She didn't get out of the house at all. She was just stuck in here doing nothing.
Catherine herself is now trying to keep fit before going off to university, a place she's deferred until after her mother's operation.
I am trying to lose weight. I am on a diet at the moment. I've lost about £6 so far. And I am quite jealous that she is losing the weight and that she will might be smaller than me, and we always have our little jokes about it. She's like, I'm going to be smaller than you. I'm like, yeah, whatever, I don't care. I won't listen. That's why I'm on that bike all the time.
For Jane, her 15-stone weight loss has already given her a new confidence.
I said to the kids I might go out and get myself another husband. They said, no, don't do that, Mum. I'm not going to allow it. I said, well, it depends if you lot are grown up and got your own relationships, you know. It's time for me.
Alan White is still waiting for his bypass operation. He's 59 years old and weighs more than 27 stone. Hard to believe that he was once a fighting fit soldier and an athletic sportsman. This is what 15 years of overeating has done to his body.
I think how I used to be, how fit I used to be, and because of my weight now, I'm not very fit at all. I know it's my own fault. I'm the guy who has made the food, and I'm the guy that eats it. Nobody forces me to.
Alan lives in Littlehampton in Sussex with his wife Kate. They've been married for 39 years.
If somebody had said when we first met that he 27 stone, I wouldn't have believed it. He was active. He was all over the place. But it's different now.
When I was a young man, fitness to me was second nature. I used to do football, rugby, swimming. I once done the mile in 4 minutes 20 seconds. They really thought I was going to be an athlete.
After the army, Alan worked in the catering industry and then as a milkman, but his obesity means he hasn't been able to work for years.
If I wasn't the weight I am now, there's loads of things I'd be able to do. The most important to me would be to get a job, you know, to be able to take my place back in society.
At home, Alan does most of the cooking and he loves it. He did, after all, end up in the Army Catering Corps.
I do love food. I love cooking food. I like using fresh ingredients, and I make all my sauces fresh. So therefore I'm getting the natural goodness out of what I do. You're looking at the pan and you'll see a lot of food, and that is my problem. Yeah, although what I cook is healthy and it's good fresh produce, I cook too much.
Alan dates his huge increase in weight to giving up cigarettes 15 years ago. He was smoking 80 or more a day.
I had to find something to replace it. And unfortunately for me, that was food. Going from eating normally to eating 2 or 3 times what a normal person would eat. I think I might be addicted to food. There's no replacement. You know, before it was cigarettes. I feel the need to be eating something. I feel the need to be full all the time.
For those people who are truly addicted to food, it is probably the hardest of addictions to deal with, because you can't give it up totally. Unlike cigarettes, alcohol, drugs that you can live without, food you still have to eat. And to deny yourself an addiction by parts is really, really tough.
This addiction to food has had dire consequences for Alan's health.
I have diabetes, I have a thyroid problem, I have severe arthritis, I need a new knee joint, my blood pressure is only under control because I take medication for it. I have to take warfarin to keep my blood to a certain level so it passes through my heart properly, so I don't get problems with that. I'm not a well man, you know.
With this catalogue of illnesses, from his heart to his joints, it's not surprising that Alan has tried to diet. And Kate has done her best to help.
I've never told him to stop eating. I mean, he goes on diets. I mean, we've been on diets together. But after a while, the weight stops. You stop losing weight, and he gets disheartened. And he thinks, I'll just have this piece of chocolate, and off we go again.
Call this an half nice, you know. Oh, yummy. Mm. There is an answer. There is a way out of it. Simply stop eating. Not eat so much. And by that, I mean drastically cut down the amount of food that I eat.
But it's reached the point where Alan is so desperate to change his life that he's prepared to go under the surgeon's knife. With the date for his operation now fixed, Alan has an appointment at the hospital with anaesthetist Dr. Rob Hill.
I believe you've got some heart problems.
I have got a heart problem, but I'm not sure what it is. You know, I've got diabetes, thyroid problems. I've got a blood pressure thing, but that's under control, you know, with drugs I'm taking.
So you had an echocardiogram, which is of your heart.
Yeah.
Was it a few years ago?
3 or 4 years ago.
And I think it showed that you had an enlarged heart.
Yeah.
So what we probably need to do is get your echocardiogram of your heart repeated again. So we have an up-to-date echo, and then we can assess how well your heart is actually working. Do you get short of breath at night time?
No.
How many pillows do you have at night?
I just have one on the back of the chair because I sleep in the chair.
You sleep in a chair?
Yeah.
Why is that? Why do you
I'm frightened to lay down. You know, I was once told that if I laid down, I'd stop breathing.
Right. At night time, as far as you know, do you snore?
I sleep upstairs, he sleeps downstairs. We have a window.
Yes.
The windows correspond. He snores.
He does
He
snore.
snores, yes.
We might have to possibly do some sleep studies as well on you to work out whether you've got this condition called obstructive sleep apnea.
Yeah.
And if you find you have, we may treat it for your obstructive sleep apnea for about, say, 3 months before we actually go ahead with the surgery. But it's again making sure everything is just perfect before we go ahead with your operation.
That just sounds bad news for me. I was hoping it was going to get over and done with before Christmas, you know. Okay then.
Okay, well, it's been nice.
Thanks very much.
Okay then.
All right.
So Alan has to cope with further delays before he gets the operation he desperately needs. The day of Jane's operation to remove the huge apron of flesh around her stomach has finally arrived. She's in the operating theatre and the anaesthetist has already made her unconscious, ready for surgery.
Now that Jane's asleep, we can actually see the extent of her abdominal apron and the hernia. So for patients like Jane, this is not just a cosmetic operation. This is about trying to stop this developing into something that will cause her ill health. So this is every bit a medical procedure as her original bypass. And as you can see, the bit of her apron that hung down, it's all thickened and full of fluid, what we call edema, and this is never going to go away because gravity holds it there. And unless we take it away, it's never going to be anything other than a real impediment to her mobility.
Shaw Summers is in effect carrying out 2 operations in one. Before amputating her apron, he must first repair Jane's hernia.
What you can see here is a gap in the tummy muscles. This is the muscle of Jane's tummy. There's a gap through which this hernia is protruded, and there's intestine in here, there's a bit of fat. That all needs to go back in. And you can see why it's been so uncomfortable. If someone got hold of your intestines and pinched it like that every time you moved around, it'd be sore.
Once the intestine has been pushed back, Shaw uses an artificial mesh to reinforce the stomach wall.
Polyester itself is a bit like neck curtains or sister's knickers. And that is coated on one side by a special jelly-like film to stop the intestines from sticking to the actual mesh itself.
With the hernia fixed, Shaw can begin to remove Jane's excess fat.
Right, big blade, thank you.
First, Shaw must make the incision across the top of Jane's unwanted flesh. It's not without its dangers.
Because the wound is so big, I've got to do my best to minimise the blood loss at each stage, because otherwise it all adds up, and if Jane loses a fair bit of blood, it might make it more difficult for her to recover. We might have to give her a blood transfusion.
With the first cut complete, Shaw has now reached a crucial point in the operation.
Okay, what I've got to do now is, having completed the top edge of the cut, I can't go too far down without checking how far I need to go to marry up with the bottom edge of the wound. So my fingers are just literally half an inch apart at most. So everything in my forearm's got to come away. And what I've now got to do is make the cut there. So sharp knife, sister, new blade. I feel like a tennis player in new blades. This ain't for the faint-hearted, this kind of surgery. You get to a stage like this where you've got a very big hole and you just think, oh my God, is this ever going to close?
After nearly 2 hours, Shaw prepares to make the final cut.
Okay, just going to divide the last bit. Ping, that's where her tummy button was. Now, I've just got to roll this out, make sure there's no other attachments. That's got to be at least 2 stone. Ready? Phew. Now, the most important thing is how on earth are we going to close this? But I know for a fact that I've left enough skin that this will actually come together and leave her a nice flat tummy.
It's 2 stone 6.
That's 2.5 stone in a day. That's some kind of weight loss plan.
All that's left now is for Shaw to stitch up the metre-long wound.
I'm very pleased. That looks about as symmetrical as I could ever have wished it. And given the amount of skin we've removed, I think she'll find that an absolute revolution in her ability to mobilise.
For Jane, the final leg of her long journey is over.
Hello, Jane. Just waking up. You take some nice deep breaths for us.
Alan White's journey is just beginning. He's ready for his operation, but there's a last-minute problem.
Oh.
Yes, I'm really sorry about that. I know you've kind of been building yourself up.
Alan White weighs almost 30 stone. For years he's tried dieting without success. As he's got bigger and bigger, his health has got worse and worse. The only solution was weight loss surgery, and Shaw Summers agreed to give him a gastric bypass operation.
Alan's fairly typical of another group of patients we have, and that is the sort of older patient who's struggled with weight throughout their life, and they've now reached the stage where they just can't carry that weight anymore. Alan is 27 stone 9, and at that sort of weight, his joints are going to give up. Indeed, his knee is shot, essentially. He's also going to stop being able to support his weight in terms of heart function, respiratory function, and he will gradually have to stop doing everything, and that, unfortunately, in the end, leads to a very unhappy existence and an early demise.
Despite his ballooning weight, Alan's done his best to stay active, though he can barely stand up. Once a week, he teaches table tennis to young people. But nothing is easy, and Kate's help is vital.
It upsets me a little bit that when we go to table tennis at the schools, my wife has to set up the tables for me. I just can't manage it.
I go and I put up tables. And I take them down again. I spend my life putting those tables up and taking them down again.
Yeah, bring it up a bit further. It still gives you that guilt trip. You know, if I wasn't as big as I am, she wouldn't have to do that. If I was to make a list of the things I don't like about being big, I think freedom is top of the list. And by that I mean not being able to do what I want to do. I want to, you know, as I say, table tennis, it's a big thing in my life. I want to be able to coach table tennis standing up.
Each session, Alan struggles to do just that, but it takes a lot out of him.
We're going to go through what we've done. Tom, at the other end of the table. Table tennis is about moving from side to side, and I can't do that because of my weight. I can stand up out of my wheelchair for a couple of minutes at the most. This is the ready position, okay? Your opponent knows when you get to the table, that means you're ready to play. Right, I've got to sit down now. Okay, guys, carry on.
Watching these young people is a painful reminder of how it used to be.
It does frustrate me sometimes that I can't perform how I want to perform. Playing, I'd love to be able to play a table tennis match standing up. I used to be really good, but now, because I play in a wheelchair, people just hit the ball past you. I'd love to lose all the excess weight I've got. I'd like to be nice and thin, I'd like to be nice and active again, and I'd really, really like to start being competitive again.
So in spite of his obesity, Alan makes every effort to make sure his fitness doesn't deteriorate anymore. 3 times a week he comes to the local swimming pool, and in the water, he's a different man.
It feels great to be in the water. You know, I can do all sorts of exercises. I've got no pain at all in my legs. You know, I really feel great. I don't think, yeah, I'm 28 stone, maybe 29 stone. I don't think about that. I get in a pool and I'm just me. But life without this sort of exercise and being able to swim, it's just not there thinking about. It certainly saves my life.
Alan is trying to overcome a dilemma faced by many obese patients. Too heavy to exercise, and without exercise, they can't lose weight. It's particularly acute for Alan, as Surgeon Shaw Summers knows too well.
Alan needs a new knee in order to mobilise and get on and do things that he wants to do. He is actually an active man. He wants to play table tennis again. He wants to get on with his life, move around, walk places. He just can't do it because his knee is giving up. He can't have a new knee because he's too heavy. He can't lose weight because of his knee. And he's just stuck.
Alan's surgery is only weeks away, but it's not getting any easier at home.
Oh. The things that I do for him, I fetch and carry. I bring things in from the car, I take things out to the car.
It's digging in again, look.
The things that he can't do for himself, I do.
Is it sore?
No, I can't feel it.
Hold tight.
Dead.
I change his socks because he can't get to his socks and he has to have compression socks.
Oh, my toe!
Sorry.
At the moment, my legs are terrible. I have to wear pressure stockings, otherwise my legs would just blister and ulcerate, and then I'd have to go into what they call a 4-layer bandage. The moment you put a new sock on there, it feels really comfortable.
All right.
Yeah, it's smashing, lovely. Cheers, babe. Kate gets upset because I'm upset. It worries me, and because, you know, we've been married that long now, we feel for each other so much.
I do worry about him, yes. A lot. I worry when I'm at work and he's here. And I worry when he goes away anywhere. That's just the way I am. I'm terrible. I don't see Alan as he is. I see him how he was. It's terrible, really, I suppose. But I see the Alan I met.
That Alan could cope with the stairs without the help of a lift. Now the only time he goes upstairs at all is to use the bathroom.
I'm lucky at the moment, where I go to the toilet, I can look after myself. There have been a couple of occasions when I've had to ask the wife to look after me, and she's quite readily done it. It's embarrassing, but at the same time, I do the same for her.
But perhaps the most disruptive effect of Alan's obesity on his marriage is that for years he and Kate have been forced to sleep apart.
I have to sleep in an armchair in the living room. The wife sleeps in a super king-size bed upstairs. She's accepted it. We're not happy with it, but that's the way it is. You know, I can't lay down and go to sleep, and I can't. I've tried sitting up in the bed, and it doesn't work.
It upsets me that he can't come upstairs, but that's the way it is. I mean, we've been married for 38 years, so we're quite used to each other by now.
With the impact of Alan's weight getting increasingly problematic, they can't wait for him to have surgery. When the day for his operation finally arrives, Alan is apprehensive, but ready to go ahead with the surgery he hopes will transform his life.
Well, this is it. I'm ready for it. I've been waiting for this for a couple of years now. No, I'm not nervous. I'll tell myself that anyway.
Alan's been on a milk diet to shrink his liver, making it easier for Shaw Summers to operate. It should also have reduced his weight. And it's good news when he gets to the weighing scales.
I was 172 something.
Oh, right, I was just going to have a look through now.
I don't know what the something was.
172.7. And you've been doing your milk diet for...
Yeah, 10 days, isn't it?
Okay. That's it, nice and still. 160.5. Wow. 12.2 kilos.
But amid the euphoria, there may be a problem. Shaw Summers wants Alan to have a blood test before surgery.
Alan's a pretty complicated patient to go through surgery. He's been on anticoagulant tablets for a long time because of his heart condition. Now, anticoagulant tablets can last quite a long time in the system, and Alan has only stopped taking them a day or two ago, so we have to check that his blood is no longer thinned before we can start surgery. Otherwise he might bleed excessively while I'm trying to do his operation, which would put him at increased risk. So if his blood is still too thin, then we may have to delay his surgery for a number of days, so we just have to wait to see what the test says.
It will be at least half an hour before Alan knows whether his surgery will go ahead today. The results of Alan's blood test are finally phoned through to the ward.
No? Okay. Okay, I'll let him know then. And, you'll come
And after all this time, the news is not what Alan wants to hear. Although he has stopped taking the anticoagulant drug warfarin, his blood is still too thin to risk surgery.
for an op, it's come back as 2.7.
Yeah.
Which means that they're not going to be able to do it today for you.
Oh.
Yes. I'm really sorry about that. I know you've kind of been building yourself up, haven't you?
Yeah.
It's a bitter blow for Alan and Kate.
That's bad news, isn't it?
Hmm.
I'm very disappointed. I'd keep myself up for having it done today.
We've gone through everything, and then all of a sudden, you can't. So we've got to start again, but we'll be back. Will we?
Yeah, I'm going to go and have fried egg and bacon now.
No, you're not.
But 2 days later, and Alan is back in hospital. His blood is normal again. The effects of the warfarin have worn off, and at last, the operation can go ahead.
Well, after the disappointment the other day, I've come back. I'm raring to go. I'm really happy it's happening at last. You know, all this time, all this suffering I've had. I had to get the operation over with, and it's going to be a start of a new era. The shaking isn't nerves; it's another ailment. No, I'm not nervous. I'm, as I say, I'm a little bit apprehensive because there's a few things happen afterwards that I'm not too keen about. But I just have to grin and bear it, I suppose. Try.
Alan's at the high risk end of the spectrum of patients that we would treat. Not only is he very unwell, but also he's got age against him, and he's also quite immobile. So all of those factors add up to make him a high-risk patient. I'm going to do my very best to do it keyhole for him, because I think his recovery will be easier and probably a little safer. But if it's difficult because of the way he's built inside, then I may just have to cut our losses and open him up and do it the traditional way.
One of the things I'm worried about is having to lay on my back flat, because I've tried a few times and I just panic and have to get up or roll over and try to get up. It's just a horrible feeling. I've sat up in bed for the last 5 years. I've sat up in an armchair. As I get thinner, I'm hoping that it's going to enable me to go back upstairs and use the bed upstairs and actually sleep with my wife, which is something I haven't done for many years.
It's very lonely up there with 3 teddies and a snowman. So, anyway, yeah, it'd be nice. Yeah, definitely.
Be nice, wouldn't it?
Yes.
Yeah. Kick them teddies off the bed.
Yes. All them teddies. And Piglet.
Yeah. And Piglet came too. I'll have one here. All right? Off. Yeah. See you when I get back. All right? No, it's all right.
All right.
Right, whereabouts am I going?
So just straight ahead where it says operating theatre, sir.
Yeah.
His biggest ambition is to be able to stand up and carry on teaching his table tennis. And I think if all goes well today, I'd hope he'd be able to realise that.
Pop these underneath your heels, because they're nice and soft and squidgy. Feel better? See, instant magic.
Complete empty. All the way in. All the way in. All the way. And out. Nearly.
So this is going to be the moment of truth to see whether we can actually do this keyhole or not. That looks okay there. Let's have a look at his liver. Yep. Okay, I think this is potentially doable.
Keyhole surgery means a quicker recovery for Alan and so less strain on his heart. Shaw is taking extra precautions.
I'm using a special instrument today which is going to seal the tissues as it cuts them so that we get minimal chance of bleeding. That's especially important in Alan's case because of the fact that he's got the blood thinning tablets on board, and the last thing he needs is to get a problem that requires his blood to clot actively, because he'd be at a higher risk of clotting off either a blood vessel or sending a blood clot off to somewhere where we don't want it, like his brain. Hi, Guy. This is Mr. White, who is quite a high-risk patient, despite the fact that he's got a BMI of 60 and that he's wheelchair-bound through severe arthritis of his knees and poor circulation. He actually still plays and teaches table tennis to a youth club with from a wheelchair. So he really does try his best, and I think he deserves every chance we can give him.
First of all, Shaw Summers bypasses a metre of Alan's small intestine. Now Shaw sets about reducing the size of his stomach. Again, he uses specialist equipment.
So we're using a special stapler now that staples off the stomach and then cuts between the rows of staples. But also it's got a special coating on it that reduces the chance of bleeding, because clearly in Alan's case, bleeding is going to be absolutely disastrous. Normal sized stomach could be about the size of your average honeydew melon, whereas I'm going to give him the stomach the size of a standard large egg. That will help him feel full more quickly after meals, and also restrict him from eating anything too big or bulky too quickly.
Despite the risks associated with Alan's heart condition, the operation has gone entirely to plan. With the surgery successfully completed, doctors try to bring Alan round.
Okay, gently, darling.
The lingering effects of the anaesthetic at first make him confused.
Hey, option on.
Let go.
Hey, whoa.
Definitely one for a coffee, this one.
But as the anaesthetic wears off, he finally calms down. The worst is over.
Top of the lip. Is that easier? Good, all right.
So will the operation mean that Alan will finally get back the mobility that once made him an athlete? And how has Jane Floyd's life changed now that Shaw has removed 2.5 stone of excess fat?
Phew.
Alan White once weighed nearly 30 stone. Unable to beat his addiction to food, he underwent obesity surgery. Now life could hardly be better.
It's been 3 months since I had my operation. I've lost 8 stone, 4 pounds, and I feel terrific this time.
Like Alan White, Jane Floyd lost life-changing amounts of fat after her surgery. But she was left with this, an overhang of fat that came down to her knees. Shaw Summers performed what's called an apronectomy, cutting off more than 2 stone of flesh. Life has changed dramatically for Jane. Simple things like walking to the shops are now possible.
I feel a lot happier. I feel like sometimes I can't sit still. I've got to go. I've got to be out. Yeah, I start to fidget now, and I just want to go.
Out buying clothes with her mother Mary presents new challenges for the slimmer Jane.
I've just got rid of the low because I'm down to the next size. So this size won't be long before they go. And I keep saying, well, if you want to buy me for Christmas, buy me some new underwear. Even bra sizes have gone down 2 sizes. I feel great now. Well, I've got a pair of briefs that pull your stomach in, and I've got 2 tops. This one's a 20, and this one's a large to extra large. So I'm hoping to get in by Christmas. Last time I was this size, it was 20 years ago, when I had my eldest daughter.
And at home, there's one special dress she's looking forward to wearing again.
This is my favourite dress. I can nearly get into it. It's a little bit tight, but nearly half the stone, I'll be in it. I'll be so happy. This is a size 24. It's one of my favourites. I did not want to let it go.
Jane used to rely on her children to keep the house clean. Now she can do the housework herself.
I can hoover now. I can pot about the house. It's marvellous. Even going up and down the stairs is totally different to what I used to come up and down sideways, but now I can go forwards. It's so great.
Best of all, Jane is small enough and confident enough to go down to Eastbourne to see her twin sister Sally, and she has really noticed the difference.
because you always used to know that she was sitting in a chair with the telly on, but now it's so different. She just seems happier. She goes places now. I keep ringing her up and she says, I'm on the move. I said, sit still. No, she's on the move. Can't keep her still.
Sally is due to have her own plastic surgery soon. And if all goes well for both sisters, they have a plan.
Holiday together. I've got to get a passport first. Yeah, get a passport, go on holiday together. Yeah. Just me and you. Yep. I don't know. Next time we'll probably see you in the bikini in the sea.
3 months after his gastric bypass operation and more than 8 stone lighter, Alan White is off to the pool.
I feel like a new man. You know, I feel like I've got my life back. I get around now without using my walking sticks. I feel great.
Alan has always loved to swim. Even when he was at his biggest, he tried to visit the pool each week. This was how he used to get from the changing room to the water, unable to move without his walking sticks. And this is Alan today.
I used to have to turn sideways at the edge of the pool, at the railings, and squeeze through, and struggle to get down the stairs, sideways. But now, I just walk to the pool, put my hand on the railing, get a bit of support, and walk down the stairs normally, like normal people do, because that's how I feel, normal. I swim much better, I breathe much better when I'm swimming. I'm working on, I'm going to have a dive in the pool. I haven't done that for years.
Back at home, Alan still does the cooking, but his addiction to food is now an obsession in his past.
The truth is, I don't even think about food. I don't get hungry. Sometimes I eat because I know I've got to eat, and that's unbelievable. Sometimes a very, very small portion is too much, and I mean it's less than a child's portion is what I eat.
Do you need any help?
Nah.
Right, I'll just take you
Alan's
back.
wife Kate has been amazed at the changes in her husband since the surgery.
Alan eats very little. It's dessert spoons instead of serving spoons, and small plates instead of big plates, and not a lot really.
2 plates, 1 my wife, 1 mine. My portion doesn't half cover that plate, and that is adequate for me to eat. Fills me up, and I've had all the vitamins and nutrition and everything I need in that sized meal.
I'm very glad he's had the operation. He's a lot happier. He's a lot thinner. He gets about easier.
I think the old thing of saying the sky's the limit. What I can do now is tenfold of what I could do before my operation. I'm a new man. The things I'm going to do are unbelievable. I believe I'm going to be able to do them. I don't believe I've just done that. 10 years ago, I think was the last time I dived in the swimming pool. Oh, I feel fantastic.